Hi, this is brief clinical consultation 3. Topic is related to thyroid, hyperthyroidism. So first we will look at scenario and then we proceed. So in the scenario, this is Mrs. XY. She is 31 year old. Her main complaints are increasing anxiousness, heat intolerance, weight loss and change in her eyes appearance. So starting with the introduction. Good morning, Mrs. XY. Am I right? My name is Dr. Riz. I am a medical doctor. I got some information telling that you are 31 year old and you have problem with anxiousness, weight loss, heat intolerance, and also you have noticed some change in your eyes. Is it right? Can you tell me more about your problem? What is the problem happening due to your anxiousness? Do you think that you lost your sleep, you are more irritable, you are not behaving like before? And what about your weight? How much you lost your weight? Do you think that your appetite is reduced or your appetite is increased? What about the heat intolerance? Do you like cold weather? You don't like to go in the kitchen because of the hot? What are the things you have noticed in your eyes? Is it more prominent? More redness? Any problem with the vision? Is it in your one eye or both eye? Any problem with the color vision? Do you think it is not that much bright than what it was before? Do you have any neck swelling at this moment? Have you noticed any swallowing difficulty, breathing difficulty, change in your voice, any shakiness in your hand, any change in your finger, any change in your toes? Do you feel that your heart is beating faster, sweatiness? Do you have any problem related to thyroid before? Any of the family member is having thyroid problem? Recently, any history of the pregnancy? What about your menstrual cycle? When your last menstrual cycle has came, what was the date? Are you thinking that you are pregnant or anything? Do you have children with you whom you are living at this moment? How it is affecting your life, your job, your day-to-day activity? Do you smoke? What about alcohol? Any other health issue you have? Diabetes, hypertension? Are you taking any kind of medication at this moment? Any other problem you want to tell? Okay, so what I am going to do next is I will keep on talking to you and also examine you. Is it okay? So here we can look that there is some eye changes are there. So in the examination we have to start examination, like if we can also start with the eye, we have to look from the behind, from the side, that there is process is there is present or not. We can look at here that there is lid retraction is there. We can see that there is the sclera is quite visible above this cornea. Also we can look at the ecchymosis. If there is ecchymosis and the redness is there, it means it is active condition, active disease. Also if there is the sweating, that is also mean there is active disease. Then we have to move our finger, keeping the head still, and to talk whether there is double vision is there or not. If double vision, it means there is ophthalmoplegia. But first we have to start with the vision. We have to tell that the close one eye whether she can see your face well or not, and by the other eyes as well. History we have already gone through. Just you look that anything we missed or not, and also here also you have to go through all of this during the history. The important thing is here is about what is the family history, whether the family is having thyroid or any autoimmune disease is there or not. Also to look at whether she is pregnant or any child with her is staying, so that if we are starting radioiodine, then we have to be careful. Urine incontinence, if it is there, you have to put the catheter so that other people are not exposed to radioiodine. Smoking is also important because have to do the cessation of smoking. What are the examination you have to look at? Eye we already talked about, starting with the hand palmar erythema. We have to look for the thyroid acropathy, tremor, and atrial fibrillation, tachycardia, proptosis, lid lag and lid retraction. You have to look at up and down the patients, following your finger, making a semicircle to look for the lead lag is there or not. And we already talked about that red eyes, periorbital edema. You have to look at extraocular movement. We already talked about. We have to look for the proximal myopathy, tell the patient to stand up. Also look in the leg also for the peritibial edema is there or not. Neck is the important part in the examination. We have to look for the goiter, thyroglossal cyst, inspect for any scar is there or not. Dilated vein, if it is there, it's mean there is superior vena cava obstructions can be there, so we have to look for that. And also thoracic inlets obstruction. So we have to properly feel the neck from the behind, thyroid, any lymphadenopathy. Also we have to look for the consistency, type of the swelling. Tell the patient to keep the neck little flexed so that it will be relaxed. And also we have to percuss chest for look for the retroesternal goiter, and also look for the buoy is there or not. So finally, what are the differential diagnosis? It is Graves' disease, toxic multinodal goiter, thyroiditis, ectopic thyroid tissue, and also levothyroxine if the patient is taking in. Investigation, we will not go in the more detail. T3, T4, TSH, anti-TSH receptor, thyroid reuptake, so that are important. Otherwise ultrasound, biopsy, that can be also sometime needed. The management is the main issue. First of all, if the eye is involved, we have to promptly refer the patient to the eye clinic, eye doctor. Proper care may needs artificial tear for the lubricants, tarsography, sleeping in the standing position or sitting position will be advisable for the patient. Also, if there is a optic atrophy or is there, I mean to say that there is any optic nerve compression is there, it need prompt treatment with a steroid, may need surgical intervention, or radiotherapy may be needed for the eye. Other normal treatment, if we talk about, there is drugs such as carbimazole and propylthiouracil. Also we can use some beta blocker also if the palpitation is there, such as propranolol. Other treatment option is radioiodine. Surgery is also. So that's all. Thank you. Kindly give your comment. Thank you very much.